Hello everyone, it's me Fatma Sarfaraz. I'm back with a video on professional examinations after M.B.B.S. one can take in Pakistan. And to be honest, this is totally based on my personal experience, and obviously there are many other paths one can take. So, first of all, I would like to cordially apologize for the absence, for the undue absence. But there were certain reasons for my break. I had exams, I had to do a job, and that job was in periphery, so I had network issues. And there were also some other personal reasons which contributed to my absence. So, okay, I'll be telling you about the exams which I had taken in the past 2 years. And on these exams, I'll be making an overview videos for preparing for these exams and getting done with them in the first attempt. So I took FCPS Part 1 in December 21, and that was the time I was making these videos in Rafiola. All of you followed those videos. And then I had a break. And then in October 22, I took my OET and I aced it with all 4 Bs. And in the meantime, I switched my video and I switched my job and started working with Sehat Sahulat Program Pakistan. And I had to shift to another tribal area for that. And in the meanwhile, I started prepping for my USMLE Step 1. And I took my USMLE Step 1 in May 2023. And then I had another exams booked within a month. I had 5 weeks to prepare for that. And that was MRCUG 1. I took it on 4th July 2023. And I aced that within 84%. And after that, I started prepping for my USMLE Step 2. And in the meanwhile, I gave a week or two to PGMI induction exam of KPK, and I took that in OBGYN. I aced that, and Alhamdulillah, by the grace of Allah, I had the first slot, but I had to withdraw from it due to some personal commitments and maybe professional commitments as well, or most probably due to the professional commitments. Anyways, in the coming few weeks, I'll be making videos on these exams, one video per week on how to ace FCPS 1. And I studied for FCPS 1 for a month, OET in a month or two. USMLE Step 1, I studied for like 5 to 6 months. MRCUG 1, 5 weeks. PGMI induction, 2 weeks. And USMLE Step 2 CK in 5 to 6 months again. So I'll be making videos on how to ace these exams and how to play smartly, how to go about these exams, especially if you are taking these exams with a job like me. Okay, so moving on. The perspective, these are the, okay. Along with these, I have certain upcoming exams, and this is USMLE Step 3 and MRCOG 2 UK. And USMLE Step 3 usually gets easier for those who know or those who are taking this path after you've taken the 2 steps, and especially if you have taken them in a continuity over the last 1 year. So there's not much to say over there. I'll just be making a simple prep video on how to go about it as I prepare for it myself. But that would be like later on or nearby the months, or maybe after I've taken it actually. For MRCUG 2, as far as this exam is concerned, we all know that MRCUG 2, you have to be familiar with a bunch of guidelines that are followed in UK. Like there are 13, if I'm wrong, maybe 12 or 11, but there are quite a number of guidelines. Green top ones are the top ones and the RCUG ones, but other than that, in TOG, there are other guidelines as well. So I'll be taking a topic, but my plan is to take a topic like, for example, we take STIs or we take like endometriosis, and I'll be covering all the guidelines there are for that topic, but I'll be doing it at a very slower pace as I prepare for my exam, because I am not planning to take it maybe until after January 25. So I'll be preparing for that, and I'll be making videos, but I'll be uploading the videos and the topics as I study for them for these exams. Okay, in addition to this, I have certain topics I'm covering for research, and there are just 2 study types I'll be giving an overview about. This is case reports and case series, and the bilkul top of hierarchy, that is the systematic review and meta-analysis. Why is there such a contrast? Because these are the only two types of studies that we can actually do, being a student or being at a level where we are not like physicians yet or not consultants in our specialities. Because for cohorts you have to follow patients for a very longer period of time, and we in our capacity, especially if you have to have like publications in your name in a shorter period of time, this is not something that is very doable. And the credibility of that or the viability of that study is also affected. So, case reports is something that you observe an uncommon thing, even though it's from a common disease, an uncommon presentation of a common disease, an uncommon or a rare side effect of a common drug, or an uncommon or a rare side effect or a complication of a common procedure. These are all case reports. Okay. So you can, once we have gone through the overviews, I'll not be teaching these in details because you won't be able to learn them unless you start practically working on these things. And as far as systematic review and meta analysis is concerned, although it's considered the toughest or the highest or two above what we can do, but I think that one problem that I encountered during my course of undergrad and even after graduation was that we were never properly taught that how to go by these studies or how to do these. Maybe because there is insufficient practice. In our country to practice these kind of studies, or to all we were taught was to do case controls or maybe cross sectionals. Because as a fourth year student, when we were doing academic research, I did a cross sectional studies, and that was like nearly impossible to do because I was personally pursuing study in lung cancer, and I could not find enough patients to see the association of the risk factors. And no one told us that if it would have been easier for us if we could have actually done a systematic review or maybe a meta-analysis at that point in time. So for systematic review and meta-analysis, I'll also be making an overview video. But if you want to study these in details and that how to go about it or how did I learn about it, you can, I will recommend certain courses. One is, which I personally took, was Bloomberg School of Public Health, the John Hopkins one. They have a very nice course on systematic review and meta-analysis. I'll be honest, I did it halfway through and then I left it because they were all, it was all about like following their protocols. And but in for Pakistan, if you want to practice it in Pakistan, and if you do not have sufficient time or sufficient resources, if you want to go for all the free softwares, because they were teaching that how to get a grant for it and how to do that, we don't want that. We just want to do it for free. We want to have a publication in our name, and maybe we want to have a senior author with us who can guide us through the process. There's a certain course which is offered by students or maybe graduates of Rawalpindi Medical College, and I will recommend that if you can find out how to register for them, and maybe I'll be sharing it in the link or in the description or in the comments, that you can just go for that course as well. Anyways, I'll myself be making overview videos on these topics, and after that, hopefully you'll be able to start some of your own projects. So this is the summary of the prospective videos I'm planning to do: study strategies for all the exams I cleared, research approach, OBGYN MRCOG2 guidelines. And along with that, you guys can tell me the high yield topics you are having difficulty with. Mention those in the comments. And if I have expertise over that topic, I will make a video on that. Also, in addition to this, do let me know if still any of you need those Raffiullah videos. I think there have been latest editions by now. But do let me know if you want to have the videos of Raffiullah golden points. I think I covered maybe 50% or so of the Raffiullah points at that time. I can cover the rest if you guys are still interested, and I'll go and check the Raffiullah latest edition, and I'll be making those videos for you guys as well. But do let me know in the comments that which topics do you need. If it will be easier for me and easier for you as well, that you let me know, you specify the topic for me, and I'll make a video on that. Specifically, I'm talking to people, or specifically girls who are taking, like, because most of people who appear for OBGYN part 1 or PGMI induction are females in our country. So you girls can let me know that which topics you're having difficulty with, and specify the OBGYN topics for me. That would be very easy for me to cover those topics as well for you guys. So this is pretty much it. So thank you so much for your time. And I would like to apologize once again for being absent for so long, but I would try to make it up for you guys. Thank you guys. Thank you so much.